February is Eating Disorder Awareness Month, and according to a 2021 Harvard study, about 9% of the U.S. population, or nearly 29 million Americans, will have an eating disorder in their lifetime. Joining us to discuss this, Dr. Allison Chase with the Eating Recovery Center here in Austin. Welcome, Dr. Chase. Thank you so much.
Thank you for having me.
Is that 29 million a large number? Is it getting larger?
It is a very large number, and it's a concerning number because it's a very dangerous disorder. It's dangerous physically as well as emotionally, so concerning.
Tell us the different types of eating disorders we need to know about.
Yes, well, there's anorexia nervosa, bulimia nervosa, binge eating disorder. Those are our ones we see most commonly, as well as avoidant and restrictive food, and there are a number of other disorders as well. They are where there's eating behaviors that are impairing one's functioning, and they're doing it in a way that's really dangerous to them, restricting, purging, binge eating behaviors.
A lot of people go on diets, right? That, you have your intermittent fastings. At what point does it become dangerous, and what signs do we need to watch out for?
Yeah, that's such a great question. It becomes dangerous when you see it's interfering with the things you engage in life. Well, first and foremost, if you're having any kind of physical or medical consequences, for sure. And then getting in the way of your social plans, your interactions. If you're noticing an impact on your emotional functioning, it is imperative to address it and get treatment. We do know about eating disorders that recovery is absolutely possible, and it's also really imperative to address it as early as possible. We have a much better shot at being able to help navigate all those really unhealthy behaviors.
If caught at the earliest.
If caught on the earliest
Okay.
point, and at the right level of care is another we talk about.
So then if we suspect someone to have an eating disorder, what can we do to help them?
Encourage them to seek professional help. It's really hard as a loved one, as a friend. We're not trained to do that, right? So we just want to encourage them to get to the right place to be able to get professional help, to get assessed, to see what kind of treatment would be most impactful for them.
If that person does not want to seek help, and I've been in this situation when I've confronted them and talked to the family and that friendship ended, what should I have done instead?
You shouldn't have done anything different, in the sense that you raised the issue, you expressed concern, you did what you could. Now, if we are talking about a child, adolescent, or a minor adult,
right.
Yes, it's really important to go to the adults in their life to, implore them to please get some help. But really, you can do what you can. I think you can continue to offer advice of resources that are out there, and just express how much you care about them and want them healthy.
Dr. Chase, that's a good point. What resources are out there for people?
Well, thank goodness locally we have Eating Recovery Center, which is right here in North Austin, providing different levels of care, intensive outpatient and partial hospital, which is a full day program as well. And then we have locations throughout the country for residential. Dallas has our residential location here in our fine state of Texas. But the greatest thing is that assessments are free. So you can call for a free assessment and talk to a master's level clinician in order to assess what is the best kind of course of treatment and path for you. So that's the best way to start, and that information is all on the website. So it's a great resource.
All right, Dr. Allison Chase, thank you so much for your time.
Thank you.